Thank you.
All right, thank you, Kristen. Candidates, let's move on to health care next. According to a recent poll by NBC News SurveyMonkey, one of the things Tennessee voters care most about is health care. Now, we know the three most popular aspects of the Affordable Care Act are coverage for pre-existing conditions, staying on your parents' health insurance until you're 26 years old, and the no lifetime cap on health care expenses. Governor Bredesen, we'll start with you. Will you support making those provisions part of a future overhaul of the ACA?
Those items are very important, and yes, the answer is certainly will support it. You know, I was not a supporter of the ACA, I'll be honest, when it came out. I believed that once it became the law of the land, it was our obligation to move forward and to support it. And it has done a number of good things. One of the most important is this protection against pre-existing conditions, because if you have those conditions today, it is really only a major corporation's health plan or a big union plan or the Affordable Care Act that provide any protections for those. And when you do, as the congressman has done, which is to vote time and time again to repeal the Affordable Care Act without having anything to replace it, you are in effect voting to remove any ability of someone with pre-existing conditions to obtain health insurance. I think that's just wrong.
How about that, Congressman Blackburn? Those three provisions that are so important to the public, what would you do about those three in terms of any reform?
Actually, every plan that I have voted for includes pre-existing conditions, and that was a Republican provision, as was older children staying on their parents' plans. And that is something that is going to stay there. Now, we know if Phil had his way and Hillary were president, he gave her $33,400, wanted her to be president. Hillary Clinton is the mother of government-run health care. That is a concept that Phil supports. He's written a book about it in Fresh Medicine, talks about putting a 20% surcharge on your income in order to pay for it. Tennesseans do not want government-controlled health care. Tennesseans want to be able to make their health care decisions with their physicians, and that is something that I support. Giving Tennesseans that power, my goodness, we know what TennCare and what the Affordable Care Act has done to Tennessee. Today, you've got...
Governor Bredesen, you get 30 seconds for a rebuttal.
Yeah. I've heard so much about this book. If you had actually read the book, Congressman, which I suspect you haven't, in the introduction, I talk about the importance of not having the Congress and the leadership designing a health plan for this country, but instead setting up the incentives so that the sort of very muscular economic system that we have in our country and the creativity we have can solve this problem for us.
Congressman Blackburn, your turn.
Actually, Phil said that Washington Democrats knew how to solve health care, and I think the private sector knows how to solve access to health care. He also said this was Barack Obama's most significant achievement. Health insurance costs in Tennessee have gone up 176% under the Affordable Care Act. So many Tennesseans have been priced out of the health insurance marketplace. We had 160,000 Tennessee families have to pay the insurance penalty last year.
As a follow-up, cost is an issue, no question. Yes. So, Governor Bredesen, you say you're in favor of keeping those three provisions that are so popular. How on earth would you pay for them?
Well, that is obviously the entire issue with having these is how you pay for it. The Affordable Care Act was paid for with a combination of things, which of various pieces, and those I think could be used as the basis for putting together a better system with this a little more responsive. But you know, right now we have the Affordable Care Act. We have 225,000 Tennesseans who are depending on it for their health care, and I think the sort of voting.
Okay, Congressman, just to clarify, you're for all three of those provisions, keeping those, am I correct?
These are things that have been included in bills that we have.
So how would you continue to pay for those?
One of the things that has to be done is opening up the marketplace. The Affordable Care Act is unaffordable. People cannot afford this. Open up the marketplace. A cross-state line purchase of health insurance is something that will allow individuals, families, to buy insurance that meets their needs at a price that they can afford. Now, Phil and Hillary Clinton, who he wanted to be president, would like to have government-run health care, Hillary Care.
All right, thank you. Candidates, Bob.